I just attended the Pathways Forward, action plans to advance Asian American, Native Hawaiian, and Pacific Islander mental health. This was a working group convened by SAMHSA's Office of Behavioral Health Equity. SAMHSA is the U.S. Substance Abuse and Mental Health Services Administration within the federal government. So this working group was convened because back in May 2021, President Biden signed an executive order which established and reinvigorated the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders. In January of 2023, that administration released its first ever national strategy to advance equity, justice, and opportunity for Asian Americans, Native Hawaiians, and Pacific Islander communities. In July of 2023, the White House Initiative, Asian American and Native Hawaiian Pacific Islander Mental Health Summit occurred at their headquarters. And that summit happened back in July, and that evolved into these 4 working groups, which is what I participated in. And those working groups were taking action on anti-AANHPI hate, engaging AANHPI communities with the 988 Crisis Response Network, language access and assistance, bringing new partners and strategies together with a sense of urgency, and the working group that I was actually in, building the behavioral health workforce to better serve AANHPI communities. All the working groups were really cool because they brought together about 80 people from around the country, and we were all broken up through these tracks. And it was a nice mix of people. There were educators there, psychologists, social workers, there were a handful of government workers, and then there were healthcare administrators like me. There were a couple things that I expected to gain from attending the event. I thought maybe we might run into someone who's a little newer as far as their organization. And I definitely expected to meet people who have been doing their work for 20, 30, 40, and also represent organizations that have been doing the work for 50 plus years, which we did, which was awesome. I also expected to start building relationships with other crazy mission-driven people like ourselves. While we were there was an agenda listed with the activities we had to do, like defining the problem, setting some priorities for it, different strategies to address the problem, and then of course the money, right? Finance, funding, so on and so forth. And then who's gonna take responsibility for different types of actions and what kind of timeline we're working. When it came to setting our priorities and defining the problem, the piece that I came with is, I've noticed in our work, there's this kind of weird middle ground for therapists that they graduate school, but there's this middle ground of they need clinical supervision or postdoc or postgrad or whatever that's called before they get licensed. It's challenging for them to find work because they don't have a license. So that means you cannot bill insurance for their services. And if you can't bill insurance for their services, then that significantly decreases the impact that they can have in a healthcare organization, because most of us kind of live on insurance reimbursable services. We here at IMUA, we're creating these different cash pay services where someone who has graduated but doesn't have a license can take part, whether that's health coaching or some other type of coaching, or even just some cash pay therapy, right? Discounted cash pay therapy because the therapist doesn't have a license. So we're actually in the process of doing that right now. And I think it's gonna work. We like to think what we're doing is gonna work, but I would really love is over the course of the next 2 to 3 years, and we're keeping track of all this, when we launch these services and have these pre-licensed therapists come and work with us, we're gonna be able to put together the evidence that, hey, this is one solution that you guys can do, anyone across the country, any organization, that you can do this kind of cash pay route to help these post-grad but pre-licensed therapists earn an income. So that way you can generate enough money for the company, you can provide valuable services, and also allow these folks just another way that they can get a job, another way that they can get a job and hopefully get a high-paying job. And then after that came defining the problem. Ours was pretty simple. There are not enough behavioral health therapists to help the amount of people looking for behavioral health services. So that was pretty straightforward. And everyone got to share kind of their bits and pieces because our group was representative of that mix I mentioned earlier. Educators, psychologists, social workers, government workers, healthcare administrators like myself, supportive nonprofit and advocacy groups. It was a real nice mix. So defining the problem and kind of hearing the problems that people are having in their areas of the market, of the country, I thought was really cool for my own feedback. And then we just went to setting priorities. And, I guess like anything else, right? The education heavy folks were thinking about how to solve it in the education way. Me as a healthcare administrator, I was thinking about how to solve it from like our business and up. And then the government folks were talking about different things they could do to solve it from, say, the government level down. And I think that's where the solution actually lies, right? It's from the top down and also from the bottom up. After we got our priorities together, and just a couple of points about what the priorities we ended up kind of listing out was building up the behavioral health workforce through graduate training, and of course, lack of representation. Not as many AANHPI providers compared to the amount of AANHPI people looking for services. Something I thought was really great that was brought up and put in our list of priorities is connecting with the community. Because each individual community, that's where the solution lies, right? These different community organizations, they know the different leaders within their community that can help kind of galvanize support. Each of us have an opportunity to spread the message about the work that we're doing. So even me, this is real meta, right? Even me filming this video, talking about my experience is one thing I can do, or we can do as an organization, to help spread the message of how we can support AANHPI communities for social equity, justice, language access, so on and so on and so on. There was someone in my group that shared this really great analogy that we are all weaving our own thread into this long rope of Asian American, Native Hawaiian, Pacific Islander social equity. And he was just driving the point home that there are a lot of people within the group that have been working on this issue for social equity for our communities for years, right? From the 70s, 80s, even before that. And he was just talking about how this is our part. That's how he saw it, is this is just our turn to weave in our own threads into this really long kind of rope, or maybe even tapestry. With all that being said, this great working group, all these initiatives to help social equity for Asian American, Native Hawaiian, and Pacific Islanders, should everyone attend something like this? Would it be beneficial for everybody? Of course it's beneficial. How could it not, right? Social equity, and especially if you are of the AANHPI community, of course it's helpful. At least if you're in the community, you can kind of see there's more people within the community trying to advance the ball for this thing.